Hello, welcome to this session of Financial Inclusion Week called Financial Health is a Global Priority. I'm Beth Ryan. I'm the former managing director of the Center for Financial Inclusion, and I guess the originator of Financial Inclusion Week. Once upon a time, it's wonderful to see how Financial Inclusion Week has grown in both sophistication and importance, and it's great to be back. I'm here today as the facilitator of the UNSGSA working group on financial health. The UNSGSA is United Nations Secretary General Special Advocate for Inclusive Finance for Development, Her Majesty Queen Maxima of the Netherlands. And she has convened this working group to advance the state of financial health around the world. The working group, which I am going to share my screen now and just let you see who is on the working group. No, I'm not going to share my screen. Sorry about that. We are joined today by 5 members of the working group, myself included. And let me just introduce them to you. We have Ahmed Dermish, the lead specialist for policy and advocacy at UNCDF. We have Payal Dalal. She is Senior Vice President for Social Impact and International Markets at the MasterCard Center for Inclusive Growth. We have Pia Tyag, who is the Director of the UNSGSA office. And we have Rob Levy, who is the Vice President of Research for the Financial Inclusion Network. And we're representing a group of
the Financial Health Network. Come on, at this panel.
The Financial Health Network. We are representing a group of 14 experts who all came together and really enjoyed getting to know each other and understanding how we can work together to advance the concept of financial health and its applications across the world, throughout the financial inclusion world in particular. We have worked together to come up with 3 key products, which I would recommend to all of you to take a look at. You can find them on the UNSGSA website by Googling UNSGSA Financial Health. We have one paper focused on policymakers, a second paper focused on the critical topic of how to measure financial health, and a deck that's oriented towards building the business case for the private sector involvement in financial health. So one of the things that we as a working group tackled right at the beginning was to get clear on what financial health is. And now that I can't screen share, I can tell you, I can't show you, but I can tell you that we agreed on a very specific definition, which I think is helpful for unifying the world around the concept. So the definition is: financial health or well-being is the extent to which a person or family can smoothly manage their current financial obligations and have confidence in their financial future. And then we also adopted a framework of 4 elements of financial health: day-to-day, which means smooth short-term finances and ability to meet your current financial obligations and consumption needs; resilience is the capacity to absorb financial shocks; goals being on track to reach one's longer-term goals, and finally, confidence of feeling secure and in control of one's finances. So that's what we're talking about today. It's hugely important for every person who we worry about when we worry about financial inclusion. And we find that people all around the world are striving to be financially healthy. So let's just talk a little bit about what's been going on in this world of introducing financial health into developing countries, or the concept. Let's start with Pia. Pia, why did Her Majesty decide to convene the working group? Tell us the scoop.
Thank you, Beth, and thank you, CFI, for inviting us to this Financial Inclusion Week and to having this very important panel. Well, the scoop is that Her Majesty, as UNSGSA Special Advocate, has really long advocated for financial inclusion that leads to development. So it has always been, a means to an end. So does it lead to positive outcomes in people's lives? Are they better off with this newfound access to financial services? And financial health is really, focusing the attention to those positive outcomes that we aspire for. And in doing so, it will inform policy, it will inform programs and products. So that was really the theory of change, if you will, on expanding access to financial services. Second is just the universality of the issue, that it's an issue both in developing countries. It's such an important issue when you see that, almost half of populations are not able to manage when an emergency happens, are financially stressed, and are coping and are unable to meet day to day. And so, it's relevant both in developed and developing economies. And I guess the final one that provided further impetus is the pandemic, which just really highlighted, the importance of resilience, importance of building buffers. And so with these three things, I think, that has paved the way for the creation of the working group late last year. And, all the work that has been done, as you've said, Beth, really to come up with first a definition. And, we thought it was going to be difficult, so that getting people talking about the same thing. But in the working group, we came out with a definition that you shared. And I think that's really an important first step to rallying actors to a common objective. So that's just a little bit of the rationale and backstory and where we are now.
Thanks, Pia. Payal, how does financial health fit into the work of the Center for Inclusive Growth at MasterCard?
Yeah, absolutely. And thanks to CFI for hosting this really fantastic conversation and a really needed conversation on financial health. So, the hint is in the title of our organization, the MasterCard Center for Inclusive Growth. We're really focused on inclusive growth. So making sure that everyone can take advantage and benefit from the digital economy. And for us, financial security, which is what we call financial health, is really integral into building vibrant, stable, sustainable, and prosperous economies and workforces. And so for us, financial security and financial health are incredibly important, both at the level of individual, but also, and households, but also of small businesses. And, as Pia rightfully mentioned, we're all operating in this unique circumstance of this pandemic. And we've seen now more than ever that resilience and the ability to weather volatility is incredibly important, whether you're a small business owner or whether you're a head of a household. And so for us, you can't talk about inclusive growth, you can't talk about prosperous communities and economies if you aren't starting at that basic level of ensuring that people are able to weather that volatility, meet their day-to-day financial obligations, and plan for the future. And so for us, we know that MasterCard can't succeed in a failing economy, and to ensure that we have a sustainable and prosperous economy, we need to start with financial health.
Thanks, Payal. I'm very glad you brought up the business side, because financial health does apply to business too. Rob, tell us, you've probably been working on financial health longer than any of us. but mostly in the US. So tell us how your views have changed as you've been part of this working group, looking at the global picture.
Thanks, Beth. Thanks everyone here, and thanks CFI for hosting this conversation. Yeah, the Financial Health Network, it's funny that you messed up our name slightly in the beginning, because we actually changed our name about 3 years ago from the Center for Financial Services Innovation, which had more of a focus on inclusion and access, to Financial Health Network, to represent our strategic shift to focusing on financial health, sharing very much the same definition that this working group has come around to. And so for those who might not know, the Financial Health Network is a resource primarily in the US to businesses, nonprofit organizations, policymakers, and innovators focused on improving financial health for their customers, employees, and communities. That said, I would say most of our work is focused on the role of the private sector. And we made this shift in the US, kind of really started actually after the financial crisis, which is, like 13 years ago now, where we realized that access to financial services in the US was clearly not enough to prevent millions of people from going into really dire straits and the recession and everything. And even now, where we have pretty high rates of access in the US, something close to 95%, depending on how you count it, our research shows that 2/3 of Americans are not financially healthy. So they're struggling with their ability to meet obligations, be resilient, and plan for their future. So it's certainly a problem in the US. I think as we continue to do this work, we see it's very much a problem in other developed markets that have a similar structure. And then we're even seeing it in developing markets where, as rates of inclusion start to increase, we realize that you can't have just access. Access has to lead to greater financial outcomes. And so having a financial health agenda alongside a financial inclusion agenda is just incredibly important. And we are just continuing to hear from global business leaders that they're excited about this work. They see an opportunity. And I think there's a few things that we've learned in our experience that I wanted to share, particularly on the business side. And that's one is you have to make the business case. We have to explain not why it's just good for your customers, but it's good for your business. Certainly we can say more about this in this panel. You have to support the people, support the champions that are making the change. And we have to recognize from a business perspective and policy as well, that financial health goes beyond just regulating products or building products. It's a whole enterprise effort. It's a comprehensive approach. That means it's much harder, but it also means that there's more things that can be done with it.
Thanks, Rob. Ahmed, you're actually part of an initiative to start perhaps the first global financial health entity with your new UNCDF new Center for Financial Health. What are you hoping to accomplish with that?
I think we're, if I could put it, frankly, kind of standing on the shoulders of giants, right? We've got CFI, we've got FHN, we've got the advocacy of Queen Maxima, we've got the leadership in the private sector side of MasterCard. So, how are we gonna add to that, powerhouse in a sense? And I think the UN, what I like to call Big Blue, kind of has a convening power that we feel like we can add to the mix, to put it simply. I think, UNCDF in particular, has always had a very strong microfinance sort of origins. We sort of evolved into classically mobile money. The bridge between that was financial inclusion, but we needed to scale financial inclusion. And that kind of worked in some places as mobile phones became a thing. And then it became digital at some point. We no longer said mobile, we said digital. And then all of a sudden it was sort of digital for what? Wallet for what? And we began to really see the meaningfulness of financial inclusion was really limited if you stopped at an access and usage sort of context. And so in that journey, we found that as an implementing agency and as a technical implementing agency, we were able to bring particularly local and regional level actors together from public, private sectors, and increasingly civil society. And so as we began to feel the same urgency that many of us here feel around what is meaningful about access to financial services and usage of it, the financial health concept sort of became a little bit more clear in our minds as something that we would like to get behind. So fortunately, partnering with organizations like the Monetary Authority in Singapore and local regional governments in India, we've been able to get some really great partners to help set up this global center for financial health. To put it simply, the idea is to kind of become a vertically integrated center, which is to say, rather than focusing on only measurement, which is extraordinarily important, and only focusing on advocacy, getting people around the table, again, we really need more of that. And even capital. How do we just fund more innovations and sort of, try and get the word out in terms of this can be profitable, this can be interesting, this can scale. We thought that maybe let's just be ambitious. Let's try and package all of that in a center because there's learnings amongst them. And so what we're hoping to do with the center is to do a lot of advocacy, invest in financial health oriented products and services, and really think about the capabilities and how we measure, the usage of services so that they're meaningful, so governments and private sector can actually improve how they encourage financial health. So the easy way to formulate that is the center will focus on community, capital, and capability. Capability kind of being our brackets for measurement. And with those three pillars kind of integrated, we have ways to dock in and bring in partners, many of which are around the table here, but also kind of uncover new ones. And just really be part of the conversation. So it's still early days. This is our first year. So watch this space.
Great. Well, we certainly will. A lot of you have alluded to sort of the transition from access to financial health. And it makes me wonder, is financial health just sort of rebranding financial inclusion? Is it rebranding? Is it replacing financial inclusion? How do these two things connect with each other?
Yeah, I don't mind starting. I think financial inclusion is a step towards financial health. So financial inclusion is part of the financial health journey. I don't think that we're replacing financial inclusion, but what I do think we're doing is we're trying to take a much more holistic view about an individual, a household, or a small business's financial existence. And I think what that means is it requires a whole diversity of actors to actually get towards a financially healthy population. So to me, financial inclusion is an important component of financial health. And this is about how we take a lot more holistic of a view to get to, economically healthy communities and economies.
Yeah, if I may also weigh in on that, I would agree with Payal. Definitely not a rebranding. I think there's a danger if we look at it that way, because when we defocus on one or the other, which are both extremely important, and in doing that, we might not be asking the right questions, both for inclusion and financial health, and not informing the right actions. And I would also warn that, I don't think it's also a sequential pathway, in the sense that Rob mentioned. You can look at financial health alongside financial inclusion, because it is also not automatic. And so looking at, the implications and considerations for financial health, and also understanding what drives financial inclusion, I think separately, but separately, but looking at how they contribute to each other is important. And so, just highlighting how, and also that it's not rebranding because it is not new. We've always looked at financial health and positive outcomes as what we are working for in financial inclusion. And I think what is important to highlight is that all the lessons that we have learned in these decades of pushing for access also gives us some ideas on how we could promote financial inclusion at the onset, having financial health in mind. And so I think that's an important distinction to make.
Yeah, if I may, I think the more we reflect on this, financial inclusion, if I could speak really broadly, like once you're included, you tend to stay included, right? Once you have that ID, once you have that bank account, it's easier to get the next account. It's easier to get the next service. It creates a sort of data relationship, or there's alternate ways to identify who you are and whether you're suitable for this financial service. So once you're in, broadly speaking, you're in. And so for the extraordinarily poor or marginalized, that's a landmark moment to become included, and then to increase the quality of your inclusion. As soon as we get into that space, it becomes qualitative. And I think, as we're seeing even now with sort of middle income and even high income individuals, your financial health can ebb and flow, as you relate to shocks, as you relate to circumstances. And I think giving governments, to Pia's point, giving governments and private sector actors the way to navigate, to create an environment where individuals who are included can manage their health over time is kind of a shift in how we see that journey, because we expect that kid at 14 who opens that youth bank account to stay with that bank for their lifetime. There's an entire purpose there, and to be a productive citizen. So once we start looking at that individual journey, financial health becomes a much more compelling way of making sure it serves people's needs.
Yeah, agreed. And Ahmed, the thing that you were saying made me think about is also looking at the difference between income and financial health, right? And to recognize that while there's clearly a strong correlation, both at the country and individual level, it is by far not one-to-one, and a lot of our research shows that. And it's partially, so you can have, just to put a point on that, right? You can have high income and have pretty low financial health, right? You could, in the US, that could mean you have tons of student debt or something like that. And you can also have low income and pretty high financial health if you have the right kind of tools and learnings and everything in place to manage that and make that work in your life. And so that's important to keep in mind. And often it is the financial system which makes it possible to make low income stretch and work if you have the right products and tools and information.
Yeah, I'm glad you mentioned that, Rob, because one of the things that is a challenge for us as we try to go global with this is to really look at the question of what does financial health mean for lower income people? Do we just throw up our hands and say, oh, people who are really low income can't be financially healthy? And also, what are realistic policy goals for people who are of low income? But one of the things that I see about financial health as opposed to financial inclusion, or as an evolution in the thinking, is a wider array of actors who get involved. And I wonder if anybody wants to comment on that.
I don't mind commenting first. So yeah, absolutely. I think so not only do we have to have kind of a multi-stakeholder approach, so across different sectors, but you actually, if you just take government, for example, it's now just beyond one ministry, right? It's actually, there are multiple ministries and multiple government departments that have a stake in financial health. I think the same with the private sector. So yes, it's financial service providers. They are the most natural champions in the private sector of financial health. But companies also have to think about the financial health of their employees. So it's a much more holistic view, but it's a lot more complex as well, because there are so many contributors that are going to be required to get to a state of financial health. So I think absolutely there are more people at the party that we need to invite than there were for the financial inclusion, the sphere.
Yeah, definitely. Just to agree on that point. I mean, when we look at policy implications of financial health, as well as Payal said, contributors to financial health, there's just a range. You have to look at, labor, social safety nets. Rob mentioned about income, but that's definitely, just one aspect. And so I think we really need to understand it and to ask the questions. And I don't think we have done that enough. I think in financial inclusion, we've, all the research agenda has been clear. I don't think globally it has been for financial health. And so, measurement is key, but asking the right questions as well as we move forward. So I think we're in an important point in this journey.
So I want to come back to measurement in a minute, but really one of the questions on this that I struggle with is how should the financial inclusion world, which is very bounded by the financial sector players, how should it get involved with some of the actors that are important that we just mentioned, the social safety nets, the employee representatives, the employment policies? Is this something that should the financial sector players just start reaching out, and how?
I think this brings up a really great question, because it's not always clear, and it can vary very much at a local level. in terms of who the players are. Revealing a little bit of our stripes, we focus a lot on the digital component. And I think, for lack of a better term, the unbundling of sort of classical sort of markets means they're sort of digital integrated in everything. And so let's extrapolate that, whether it's education or agriculture, you're starting to see digital payments become part of things, digital identification become part of things. And in the financial inclusion context, which has really predominantly been driven by technology as a potential solution for scale. Again, we're scaling access and usage, very clear, quantifiable outcomes. That we're starting to see, well, actually digital is now taking the capacity for that scale to just sort of integrate into other use cases. And in the UN context, the SDGs is a comfortable home for this. Water, sanitation, energy, transportation, all of these components. And as Pael was saying, there's a ministry that oversees almost all of those sectors. There's a business case that underpins all of those sectors. And so if we think about one of the great successes of financial inclusion is its capacity to make a convincing case for scale. And then digital is enabling that. Well, now we're beginning to see this integration into other use cases, if I had to use sort of jargon. And I think, at the local level, the question for the financial inclusion community is, where do we see compelling scale of these use cases that add benefit to people's lives? And then you're probably going to find your stakeholder, your counterpart on the other side of that. Right. So do people need better access to transportation and they just need to pay for the bus? Do farmers need better access to, inputs, but debundling the middleman so that the prices are more affordable for them? So who's on the other side of that? Is it paying school teachers so that they show up on time? As we look at those components of people's lives that are priorities locally, then on the other side of that, you'll find who's helping make that happen. And I think what we're seeing on the financial health side is that those counterparts actually have an interest in the financial health of the people that are participating in that use case. I realize all of that sounded really complicated. That's kind of why we're all here, right?
Well, I want to follow on that.
What's that? Go ahead.
No, I want to give a use case because I think that's right. You have to figure out what's right in your market or in the country in which you're kind of focusing. So I can give a use case from the US, right? I think what we have seen, the two sectors that have been the most kind of have shown the most opportunity to be a play for greater financial health, again, because financial inclusion, not as much of a challenge here, has been the workplace, working directly through employers, and through healthcare, which is just obviously one of the biggest expenses in people's lives, and obviously critically important to just their overall well-being. And in the workplace, we have seen tremendous opportunity where employers are increasingly focused on financial health. They often refer to it as financial well-being or financial wellness, through the employer, even down to even some smaller employers now starting to think about not just how do I provide my employee with the traditional 401k, but how do I set up the right auto escalation mechanisms, and how do I help them save for an emergency savings? How do I help them pay down their student debt? How do I help them access emergency cash or affordable credit? Kind of that next step in the ladder towards financial health and getting those products. And the employer, especially in the US, where the government isn't as involved in some of these areas, the employer has a trusted relationship with the employee and has shown to be incredibly powerful, and seen some amazing examples across the country of employers large and small, kind of really seeing the financial health and well-being of their employees as being in their own interest as well as their employees' best interest.
Mm-hmm. Maybe just a very short point to add, a practical pathway to addressing your question, Beth, is that we have these national strategies in place where we have multiple policymakers and stakeholders that are involved. I think that is a very good, could be a very good starting point. And also in financial inclusion, we learned that looking at, balancing policy objectives, integrity and stability and protection and inclusion, I think that mindset, when we apply to financial health, could also be very useful as we look at the different policy considerations that need to be balanced and that need to be forwarded beyond silos. And I think so we have these infrastructure that are in place that could be a good starting point to this.
Great. And we did, as part of the working group, we convened a group of policymakers, and we're pleased to see that several of them had already incorporated some, at least at the highest level, goals for financial health into their national financial inclusion strategies. But putting the practice around that is, I think, where we are now. Let's turn to measurement for a minute, because I think as in the working group, we've sort of, one of our mantras has been kind of measurement is the first place to start. You have to know how financially healthy your relevant population is. But what do we really learn from measuring financial health that we don't already know?
I'll start on that one because I've been living and breathing measurement for many years. And the famous axiom, what gets measured gets managed, I think proves really true. But I want to take a provocative response to your question. And you said, like, does measurement tell us something we don't really know? I'm going to say yes and no to that, because I think in some cases we do know, right? I don't think it's a shock to anyone that like a lot of people are financially struggling in the U.S., right? And let alone other countries, right? But just focus on the context in which I operate. But when we work with, say, a medium-sized bank or a credit union, and we help them measure the financial health of their own customers, they to a day are shocked to understand that their customers look a lot like the rest of the population. So even though they know and they read the news and they understand what's going on, when you measure your own customers or you measure your own employees, it's like just alarm bells go off for people. And so like, just because you don't know that it's like happening in your own home, in your own backyard with your own customers. So that's my first answer is they know, but they don't know. And then once you do measure, you can go so many places with it. And you can identify, okay, wow, look, a pocket of my employees are really struggling with debt. So I'm going to offer a debt solution, or a pocket are struggling, have no savings, and I'm going to help them there. They need coaching and I'm going to help them there. So you can start to tailor the solutions to the pockets of segments of your population that really have those needs. And then kind of out from there, where we're starting to go is not just using measurement to diagnose the problems, but actually then to measure the impact of your solutions, which is where we really want to go to see, are these innovations that I'm putting out to the market or to my customers, are they making a dent? And that's where I hope we're trying to get to.
Any other comments on measurement?
Yeah, I think, I mean, the way you phrase your question, what will it tell us that we don't already know? So much more. Beth, I think on the policy perspective, there's just so much that needs to be asked and measured, within country, for example, to know what policy solutions are relevant. What are the issues that could be solved, and what are the levers that need to be moved. And I think this is what we try to do in the working group with our policy paper, sort of just to get that process of thinking. And definitely so much more to go on measurement. I think one objective of the working group was also to have measurement that we could use across countries. So not just within country, but having an ability to benchmark with peers, to be able to look at, where we want to go, again, in comparison to peers or other similarly situationed countries. And that, I think, we also, there's still a lot of work to be done to come up with, indicators that will resonate across different country contexts, but, gives enough space for more in-depth understanding of financial health of populations within countries. So I think much more that we need to find out in this space.
So I wanted to go ahead, Payal.
Oh, sorry, Beth. I was just going to say, I think on the private sector side, obviously measurement is a challenge because we do need A, standardization, but B, to the word capability that Ahmed was talking about, we need to build the capability in financial service providers to actually be able to understand the financial health of their own clients. But there are also so many opportunities. I don't want to get lost in the fact that it is a really challenging place. But the opportunity for private sector, especially financial service providers, is that you really, when you take an attempt to measure financial health of your client base, you get a much more in-depth understanding of who your clients are and where they are on their journey, which means you can understand the strength of your client portfolio. You can think about product design in a much more human-centered way. And it also gives you a real sense about what your material risks are. As we're thinking about, ESG frameworks and doing materiality assessments, this is a really important consideration to understanding the strength and sustainability of your future organization. So I think while there are lots of challenges and we need to make sure that the private sector has the tools and the frameworks, there are also so many rich opportunities.
Let's come back to the business case. I just wanted to make one more comment on myself on measurement, and that is sort of an example of something that I feel that we've learned a lot from measurement, and that is about the volatility of income and how people who struggle the most with financial health are likely to be those who have volatile incomes. And I know UNCDF did a great paper on the gig worker. And, in some ways, gig workers are, compared to informal sector, they're one step up, but compared to full-time employees, they're more vulnerable to challenges in financial health. Let's go back to the business case, and let me just ask you whether you think the business case for financial health, as in the business case for financial services organizations to embrace financial health, is that proven? Is it clear? Is it accepted?
Yeah, so my point, because I sit outside of the US, my point would be that there's absolutely a really strong business case, but levels of adoption and understanding of financial health vary depending on the geography you're in. And so I think, the US has had the benefit of having the Financial Health Network, which is really convening financial service providers to cross-pollinate learnings and to share best practice. We don't have anything like that in emerging markets or even outside of the US. And so I'd say that the levels of understanding vary, which is why there's still such an opportunity to populate the business case outside of the US and to bring actors together to really share what's learning and where we still have to go.
Yeah, I think we should have a little empathy and, put ourselves in the position of many financial private sector institutions from MFIs upwards in terms of sort of hyper-local, tiny little organizations on the financial service side specifically, who arguably have been doing financial health for decades, right? And they've always been worried about shocks and cash flow and the ability for people to manage the things that we're trying to measure now. The tools they had were relatively simplistic because just our understanding. Tools as in like practical business-like tools. I think the sophistication of those loan officers that were going out there and having conversations with people were infinitely higher than many of the systems that we have in place. So I think, in some, at least we see in UNCDF in our country work, it can be confusing if we're not careful. And, in some cases, like, hey, we just got on this financial inclusion train. Now you want to make it financial health. So sometimes, the question of bringing the private sector on board, to sort of Payal's point, is really just making the case for what they want to achieve and understanding we see that as financial health. It doesn't always mean we have to put it front and center, right? So loyalty is more consistency, more participation in your products and services, more information about how you can make them better. In our view, that's all financial health. In their view, that's just good business. And so I think a perfect world for us would be that is the way this is seen. And for those who want to participate in global advocacy on financial health and local advocacy, great. But for those who just do it as by day-to-day work, even better. So I don't want to, I think from our view, overemphasizing financial health in the private sector context can actually be counterproductive because it sounds like we're bringing a development problem to a market problem, right? And there's some nuance there. And we really have to be careful about how we communicate it so that we can really just get those sort of new participants on board.
Yeah, I'll add just a couple of things. I think from our perspective, the business case for financial health has been made at the conceptual level, but actually making it at the business level or the economic level is much more difficult and is a work in progress, right? I think we all kind of get that if your customers have more money, like the very raw, like they're going to have more money to spend with you. And if they see you as having helped them get more financially healthy, it sort of seems likely that they're going to be more likely to do more things with you and recommend you. And our data proves that out in the US. So conceptually, I think it makes sense, with some exception, right? Like certain products, like particularly like overdraft, for example, that rely on fees in a kind of a negative way. I think those products make more money when customers do worse. And so there may be some products that don't fit within a financial health agenda, but most products should be more profitable for the bank or the company of any kind when their customers are doing better. But what we need to do is prove that out. And you need to prove that out at like the product level, the market level, the segment level, and then the business level. That's work to do.
So we're getting some questions from outside, and one of the questions directs us to what I was going to ask anyway, which is turning to the policy agenda for financial health. And the question is whether the policy agenda is clear, and are there any examples of policies that of the influence of financial health thinking on policy? What, in those places where there is work on financial health, how has it affected policy? So both the questions of what should happen and what has happened.
I think with what has happened, I think, Rob, you in the US, you might be closer to that, because I can't think of many other places where it's been an intention, right? I have some thoughts on the other half of the question, but Rob, why don't you go ahead? Put you on the spot.
I actually think we haven't made as much progress in the policy arena as we have in the private sector arena in the US, in terms of kind of expanding the lens beyond financial health. I mean, look, we're in the middle of a huge debate in the US around several measures like, paid leave and childcare subsidies and child tax credits that will have dramatic implications on financial health. So to some extent, like the current debate in this country is a financial health debate, although we're not quite framing it that way. So I do think we are having this conversation. But I will give you one example that's making just the initial bit of progress, which is around this question of government measurement. Sorry, my son is next door. Apologize if you hear that. I think the question is, right, we know in the US that the metrics we use, that particularly the government puts out from the government institutions like GDP, unemployment, and some of even the other kind of well-accepted numbers like consumer confidence index, they don't really measure what's happening at the household level. And they certainly don't measure it in a disaggregated way. They give you averages or they give you lump sums. We don't see what's happening at the quartile or quintile. We don't see what's happening at different population groups. So I think one of the biggest efforts from a policy perspective is to change the way the government measures economic indicators, which are proxies for financial health, whether we like it or not, but are bad proxies. And so some efforts that we've done, and that the Washington Center for Equitable Growth, I hope I got that name right, has been a real leader here, is by putting forth examples of the type of new indicators that the government needs to measure and put out publicly at the same level they put out quarterly GDP, to get us all thinking in the right level. So that's maybe one example.
Yeah, I think one of the things, going beyond the US, a ton of work's been put into financial inclusion strategies, right? And those often sit with the central bank, for example. I think on the policy, and often the measurement frameworks and the measurement teams sit within the central bank. And yet, to the point that Rob was kind of making, this sort of sits above and beyond that sort of narrow remit of the central bank, whose really job is to execute a policy through the form of regulation and that regulatory framework. I think one thing that the working group was the UNSGSA working group, thanks to your leadership, Beth, and Pia's sponsorship, was super helpful in helping at least me understand, and my colleagues, that, with financial health, we're really thinking about a policy context, and we're still unsure what regulations per se, what they need to look like. So, for example, should consumer protection regulations be seen as fundamentally enabling financial health? Do consumer protection regulations ever have to even say financial health? Or do we work with policymakers using the data and that perspective that Rob alluded to create a concrete and coherent policy framework for financial health, and then identify those levers that Pia mentioned? Then we can just let the central bank get on with it with the right sort of support and assistance and research. The interplay between the two is the measurement component. I think the measurement element is absolutely fundamental to the policy element. And if I could frame it simply, making that connection between policy intent and regulatory action, which is overseeing accountability to market outcomes, We need that measurement component to say, are we seeing the change that we want? And is that the responsibility of the institutions who are supposed to deliver, or is it the responsibility of the government to create the conditions for delivery? We can't blame the private sector for not doing things that the market context wasn't set up for. And yet equally, if they agree to be held accountable to that through regulation, then we need to monitor that accountability. And so it gets, I think for me, separating the policy and regulatory component is a starting point. And then it allows us to think through what does a coherent policy framework need to be? And then what are the measurement sort of systems that help us articulate that?
Yeah, I like that, separating the policy and regulatory. I think that helps because otherwise there's just so much to think about. You get a little bit overwhelmed.
Exactly.
But we keep coming back to measurement, and there are a couple of questions about measurement. One question is just where do I go to get information about how to measure? And let me just give a couple of ideas. Both of these are things that I worked on. So of course I think they're good and I agree with them. One is the measurement paper of the UNSGSA, and you can find that on the website. And the other is a paper on what policymakers need to know about financial health that was put out by the I2I project last year. So, but you can also go to those organizations that have been leaders in financial health measurement and just see how they've approached it. And of course, the Financial Health Network is one. The Consumer Financial Protection Bureau of the US is another. The Commonwealth Bank of Australia has done some fabulous work. And so all of those are places to look. The other question on measurement is, what do we want to measure? Pia, when you mentioned cross-country benchmarking, what is it that we want to measure in cross-country benchmarking?
Yeah, I was looking at the questions and somehow lost all of you, so I was a little bit out of the conversation for a while there. No, I think it's important to have measurement at least on the 4 elements that you mentioned in the definition, Beth. I think we have some good information on resilience, for example. The Findex asks a question about if you're able to come up with a certain lump sum when an emergency comes. I think this is a good starting point. But then having, these tested questions on the 4 elements would really be the ideal on the day-to-day, on the ability to plan and meet future goals, and also the feeling of security and confidence and agency over your finances. I think having agreeing upon a set of indicators that make sense within and across countries on these 4 elements would be the ideal.
So just a note to the audience, because we're a little bit late getting started, we have a few extra minutes. We're going to be running until 10 minutes after the hour. So please, if you have any last questions, go ahead and type them in. Let me just ask the panel how you think how has the pandemic changed the financial health picture or the thinking about financial health?
Maybe I'll just start with that, Beth. I started initially in my remarks about how this pandemic just really heightened the urgency of looking at financial health and what needs to be done, but maybe answer in a little bit more focused on just the importance of social safety nets and social transfers and the thinking around. I mean, in the pandemic, we saw how that has really become, the lifeline of many vulnerable populations. But I think it gives us an opportunity to rethink on how these programs can really be designed to build buffers. And I think this links to your last question about policy. I think that's one area. It's definitely not the only, but I think one that the pandemic has given us a very important opportunity to look at design and the role of different stakeholders in looking how these could really build buffers, looking at building resilience over time. So just one area that I think was really highlighted in this pandemic.
Yeah, I can build off that. I think that's absolutely right. I feel like the attention to this issue has just grown exponentially over the past 2 years. So people both looking at the challenges around financial health, around resiliency, and then particular challenges that, like especially in the U.S., communities of color are facing, and how the disproportionate impact of some of these issues on those communities. I feel like that went from research paper news to like front page news, like almost every day. I also think like the amount of good research as a researcher that has like increased, particularly in the US, has been fantastic. The US Census started doing like weekly and now bi-weekly polls on these issues. Number of other organizations have come out with just like fantastic data. So there's more data. And then the more data, I think, has actually reinforced the importance of measurement, and how measurement sometimes tells you something you didn't expect. Like, frankly, when I thought the sky was falling a year and a half ago, I was like, wow, we're heading into a recession. Financial health is going to plummet. And in our latest report, financial health is at the highest level on average, not for everyone, but on average, since we've been measuring it for 5 years because of government intervention, right? The massive relief programs we had in the United States. So now we saw how impactful those relief programs can be, where they missed the mark, and now we're having a debate about where this all should go. But that's only possible because we have such close to real-time measurement now. So that's been a great thing that's come out of this.
Yeah, exactly the same thing happened in Australia, where the financial health rose, even though because of the government programs. But then in those countries, most of the rest of the world didn't have that luxury of having a government that could help provide a social safety net.
Can I just real quick though on that, Beth? It's less about the government being able to provide, but it's also not less, but it's in addition to that, it's the absence of an infrastructure. I think the one thing we've learned is that if you don't have the access and usage component locked down, you don't have the opportunity as a government to influence people's lives in such a direct fashion. And I think, it's still early days, but the pandemic has certainly made that case between fundamental level 1 infrastructure and the potential for government intervention. And we've seen that government intervention happen to move the financial health needle in a particular direction. That case is rock solid now. Now, whether we can help governments act on that and building that infrastructure, multi-year projects and programs that are extraordinarily complicated and technology driven, like that's kind of where we're at now.
And today happens to be election day in the U.S. and especially in Virginia, where I'm sitting. And I really hope that the support for the child child payments that is exactly what financial health tells you is needed, and we should be doing it.
And Beth, if I could just pick up on one of the points Rob made, which was around underserved communities. I think the data we've seen is shown that underserved communities, particularly women, have been disproportionately impacted by the pandemic. So what that prompts me to think about is how we're gender intentional as we're thinking about financial health, because women are going to have a whole different set of contexts that need to be addressed to get to financial health. Same with populations of color. And so I think as we're thinking about financial health, yes, there's some macro things, but we have to recognize that underserved communities are going to require some special, have different contexts and unique contexts that we need to ensure we create an enabling environment for.
And from our view, that ability to recognize those structures, those biases against that prevent women from having, for example, the same degree of participation as men or other marginalized communities. I think this is where the financial health debate has been extraordinarily helpful for us, particularly in speaking to governments. It's given us a language, because when we talk about, traditionally, we would have talked about those contexts and been really inaccurate or imperfect. And then a willing government would say, okay, what do we do? What are we looking to observe here? Well, now we've got some ways to measure that, right? And to say, well, these are how you would describe those contexts. Here's some suggested measurement frameworks that we can determine the degree to which that's happening and what scale. Then we can think about sort of in the government context, the policy response to that. And so even, I mean, a few years ago, we weren't even really able to recognize the structures in those contexts in a way that was compelling and sort of formulated the way financial health allows us to. We were in pockets. I think now we're sharing that much more broadly, beyond the research community, beyond just experts. And I think in the case of women's economic empowerment, being able to just have that lexicon, have a measurement framework to describe those contexts for a UN agency is massively empowering for us to help with that agenda.
So we're reaching the end of the time. I wanted to just go back for 1 second and make a pitch for the on the policy. We sort of segued away from policy, but going back to that, there was a request for examples of policy, and I just want to refer people to the UK Money and Pensions Service. I think that if I look around the world, the country that has integrated financial health most sort of deliberately into policy may be the UK. And it created a special organization called the UK Money and Pensions Service, which then identified through research the 5 top financial health problems that people in the UK have. And it works across sectors to address those problems. So it works with the Financial Conduct Authority, it works with employers, it works with nonprofits, and just has a whole spectrum of ways of tackling these 5 priority financial health projects. So look up the if you want to follow up on what's the policy agenda can look like, take a look at their work. I want to give each person a chance to look to the future. What do you want to see happen as the next steps in advancing financial health and helping the customers that we care about become more financially healthy? Pia, go ahead.
Yeah, maybe I'll start, and it'll be very much aligned to the 3 work streams of the UNSGSA working group. Of course, the vision of having, policymakers across the world for both developed and developing emerging economies appreciate and understand the importance of financial health as a policy objective, but also as it relates to other important socioeconomic policy objectives. I think getting that appreciation and understanding will really pave the way for investments in measurement, investments in getting, collaboration and interagency coordination going. I think it really starts there. And so that is the vision. We want to continue the dialogue there, ask the right questions, elevate all the evidence that we already have where we have them. Second is, of course, measurement, which is closely linked. The last one is really the role of the private sector. And we've talked about, you've all mentioned about the importance of financial sector providers, but, all companies that are also looking at financial health of their employees is key. And as Payal also mentioned, financial health of SMEs. And so looking at what the private sector can do in this space, getting, I guess starting with a coalition of the willing to see, sharing experiences and spreading these knowledge and information broadly. That's really what the hope is. And of course, comparable set of measures that we could use as benchmark would be in the wish list.
Great, thanks, Pia.
Yep, from our side, I think what I would love to see is us getting out of the way and really creating mechanisms where we can hear directly from people themselves. So one area where we're certainly trying to innovate a little bit more is how do we promote more civic engagement, more voice of civil society in this dialogue as a convener? And to your points on the UK, one of the things about the UK that enables that sophistication around financial health is an extraordinarily well-organized civil society around rights and responsibilities of the private sector, irrespective of the sector itself, and a government that listens to them. So that's something I certainly would love to see more of. And I think with our Global Center for Financial Health, what we want to do is create a receptive audience through our community building use some capital to invest in products that can respond to that voice, and really double down on this measurement component. So then when we try and apply those lessons from what we've heard is the need, we can measure whether it's working and then just iterate in that way. So even in that community capital and capacity component, really at the middle of that, we should try and find ways to put the customer and organizations of the customer, consumer rights groups, et cetera, front and center. I would love to see more of that, rather than us, always being the middle person. Like, let's just get out of the way, let that voice be heard. Not that I don't love this conversation, right? I'm just put it in context.
Yeah, and for me, I just using Pia's term around the coalition of the willing, I just want to make sure that we are expanding a global coalition of the willing, and that we're incorporating players that weren't necessarily part of the financial inclusion debate. I think about digital marketplaces, for example. So much now is digital and e-commerce, and those marketplaces, those platforms absolutely have a role in financial health. And so we need to expand, but we also need to invite some of the less traditional players that weren't with us in the financial inclusion journey.
Yeah, I agree with literally everything that's been said here. And the thing I would add, I think, particularly on that coalition of the willing, I'm also really excited to get data around the business case, to come back to that earlier question and start building up that data set that we need to, because the coalition of the willing and the mission aligned is only going to go so far. When you add in the business case, then we really bring in everybody, for better or worse. And I also, from like where we go from here, particularly thinking about corporate leadership, we've seen so many great and big statements and actions from corporate leaders globally and in the US. I really want to see, like, where does that go over the next few years? How do we make sure that we don't lose that energy, and in fact actually hold corporate leaders accountable to those statements and make sure that they're measuring the impact that they're having, so that it grows and we see the fruits of that labor.
Thank you all. We're out of time. Thanks for listening. And I hope that each of you will take home some new ideas about how to pursue financial health.
Thanks.
Thanks, guys.
Bye.
Thanks, Beth.
Bye. Thank you, everyone.
Take care, guys. Bye.
Thanks, everyone.